Hey everyone, so today we are going to talk about drugs for osteoporosis. So me and Mr. Bones are going to get started. Now, what is osteoporosis? How do we define this disease? Well, or disorder rather. It's not a disease, you can't catch osteoporosis, but this disorder is a condition in which bones become weaker and more brittle over time. So often osteoporosis is just a normal fact of aging, although it is more common in women than in men. So as people grow older, new bone creation cannot keep up with the old bone cell removal processes in the body. So all through our lives, as we grow, as we age, our bones replenish themselves. So we have bone removal processes and new bone creation processes where they get rid of the old bone cells and replace them with new bone cells. And that keeps our bones strong and healthy throughout our lives, because you can't have the same bone cells all the time, or else they'll eventually get brittle and maybe be a little bit more weak, and you might be more prone to fracture. So our body naturally recycles and replenishes our bone cells essentially. So what happens eventually though, as people grow older, the new bone creation cannot keep up with removing the old bone cells. So because of that, the bones get more brittle, and that increases the risk of bone fracture and breaking. However, it's very tough to diagnose because there are very few signs and symptoms of osteoporosis. You can't feel really if you have osteoporosis. You can, however, recognize some signs. So as you can see with this poor guy right here, there's a loss of height over time. I know this happens with our grandparents and maybe some other older folks you might know. They start to shrink as they get older, and that might be partially due to the fractured or collapsed vertebrae of their spine, literally forcing their stature down. And that can also cause some back pain. Now, bone breaks are also more easily broken than expected. So a bone may break simply by falling when otherwise someone would have been fine. That may be a sign of osteoporosis as well, because when someone breaks a bone having a fairly run-of-the-mill accident, that might be a cause for concern. Now, specifically, osteoporosis is diagnosed with a specialized X-ray or bone scan, and that can determine exactly how strong the person's bones are. One of the things we can, of course, do to prevent osteoporosis and to keep our bones healthy and strong is to have a solid intake of calcium and vitamin D, as well as a consistent exercise, and that can help support bone health. So, got milk? You should if you have osteoporosis. And this just is an illustration to show you exactly what I'm talking about when I say that old bone is not being replenished with the new bone quite as it should. So this normal bone in the vertebrae, this is the spine right here, this normal bone, you can see it's pretty dense, that it can hold up over the stress of holding up the body in an upright position. However, this osteoporotic bone, you can see it almost looks hollow. It has a lot of these sort of canyons within it, and that's because that old bone that is getting resorbed is not being replaced with new bone creation. So when that process is unbalanced, that's what you get with osteoporotic bone. And of course, that can compress vertebrae, cause some back pain, and make these bones break a bit more easily. So we have a few osteoporosis drugs to choose from. The main ones that you would see all of the time are bisphosphonates. Now, they work by inhibiting the resorption of bone. So that's the removal of old bone. So they stop that bodily process of resorbing or removing the old bone. So it keeps it around for a bit longer while not affecting the rate of that new bone formation. So it doesn't cure osteoporosis, but it does slow down the progression of bone loss, and it can prevent fractures over time. It decreases that risk of fracture in osteoporotic patients. Now, the biggest important note with bisphosphonate drugs: do not lay down for 30 minutes after taking these drugs, and you have to take them with a full glass of water. Why? It's because of those side effects. The big side effect with bisphosphonates are heartburn, stomach, and esophageal irritation. So they are very, very irritating on the stomach and the esophagus, that tract from your mouth to your stomach. If you were to lay down, that can cause ulceration, these open wounds within the esophagus, can be very painful heartburn, and it can cause bleeding in the esophagus and that tube between your mouth and your stomach. So that can cause a lot of issues. Now, As one might expect, you have other GI or gastrointestinal side effects as well that are associated with bisphosphonates. This is specifically abdominal pain and constipation. Now, there's also a rare jaw fracture risk. So that's one thing that may possibly come up. A bit of an odd side effect considering you're trying to prevent fractures, but through studies, they have concluded that there is a possible greater risk of a fracture of the jaw when taking bisphosphonates. So examples of bisphosphonates, and you'll notice they all end in nate, so super easy to remember this category of drug, right? Are alendronate or Fosamax. We have ibandronate or Boniva, and we have risendronate, which is Actonel. So they all end in nate, and you'll notice that instead of taking them daily, they're taken either weekly or monthly. So alendronate is taken as a tablet, and it's once weekly. So a lot of these people on the back of this box, you'll see like a little schedule that'll say like, oh, I took my first dose of alendronate on this date. I will take it at the same time, this date next week. So a lot of people, you keep those boxes in order to keep a schedule of their medication administration. Next, we have ibandronate, which is taken once monthly, and it can also be administered. It's either a tablet or it can also be administered via an IV, which I would assume would actually be pretty good considering it might be helpful for patients who have, maybe they have gastroesophageal reflux problems. They might have heartburn problems to begin with. They might be high risk for bleeding or other stomach issues. So ibandronate might be a very good option for those patients who may not be able to take the oral bisphosphonate medication. And then risendronate, it's a tablet once weekly or once monthly, depending on the dosage selected. So you can sort of pick and choose with risendronate. And lastly, we have this sort of oddball osteoporosis treatment drug, and it's raloxifene or Evista. Now, Evista is a selective estrogen receptor modulator, or a SERM, and it acts as a missed agonist and antagonist on estrogen receptors in the body. Well, what does that have to do with bone health, you ask? Well, an imbalance of estrogen hormones, so this is that hormone that is used in many oral contraceptive drugs. It's used in hormonal therapies in general. Well, an imbalance of estrogen might also lead to bone loss and osteoporosis, especially for women after going through menopause because they have lower estrogen levels. So it's also, actually, the cool thing about raloxifene, it's also used to decrease the risk of breast cancer in women who are at risk. So say if someone has osteoporosis and they're a woman of a certain age post-menopause, and they also have a breast cancer risk, raloxifene might be the go-to. Now, these tablets are used to treat and prevent osteoporosis. It can't cure it, but it can treat and prevent it and decrease that risk of fracture. Again, with the added thing though, because it is an estrogen modulator, as with any of those estrogen drugs, we have an increased risk of stroke, deep vein thrombosis, and pulmonary embolism. So it shouldn't be used in patients with a history of venous thromboembolism or VTE. So if they have a history of blood clots, do not use this in those patients. The other side effect that you would think of with this, considering it's a hormone, it messes with the estrogen levels in order to better support bone health. It causes menopausal symptoms. So it can cause like hot flashes, those typical mood swings and other hormonal symptoms that are associated with menopause. Peripheral edema, or the swelling of limbs, and arthralgia or muscle pain are also associated with Evista. But again, it can be very useful in terms of treating and preventing fractures for preventing osteoporosis from resulting in a fracture that can be potentially devastating to a person's quality of life because of that osteoporosis. So that is the overview of osteoporosis. As always, if you have any questions, feel free.